Hi, everyone. Thanks for joining us at Health Virtual. My name is Blake Dodge, and I'm a healthcare reporter at Business Insider. I'm joined by Jason Gorevic, the CEO of Teladoc Health. Teladoc is a massive telehealth company worth almost $18 billion that serves about 70 million members around the world. I'd also like to introduce Glen Tullman, the founder and executive chairman of Livongo, which in many ways was the first chronic care company to really take off. Today, Livongo's client base has more than 30% of the Fortune 500 employers. Welcome to you both.
Great,
Thanks,
thank
Blake.
you.
We're happy to be here.
So Jason, your bid for Glen's business is $18.5 billion. Pending any huge disagreements between the two of you, that stands to be the biggest deal that digital health has ever seen. And you guys have talked a lot about the importance of culture in deciding to merge in the first place. That's essentially why the deal came together in less than a month. What does that mean, culture? And what are the two of you trying to accomplish together?
Well, I think it starts with a common vision, a vision for bringing together two complementary companies with complementary capabilities and assets driven toward delivering whole person care and really changing the healthcare experience for consumers to deliver better outcomes, lower costs, and an overall better experience. And so that mission orientation is very strong within both companies. And then you put that together with a culture that's focused on innovation, collaboration, and really working with the healthcare system to transform it. And that's what made some of those first conversations much easier than you would expect, right? Glenn and I shared a common vision and saw the opportunity to put these two leaders together and really change the dynamic and change the category completely. Glenn, if you want to add to that, it was an interesting beginning to the discussions.
Well, it was, and I would just say that it was easier for us because we both were close to our members, the users of our services, and really we were reflecting what they were asking for, which is one comprehensive service. We think of it as a consumer-centric virtual care experience. And all of us really want that. And so the idea and the opportunity to put that together in one place from start to finish, that's really what we saw. And so when they first heard about it, the members, the users of the services were excited. Our clients were really excited about it. For the first time in one place to be able to have all your healthcare needs taken care of and yet not lose the empathy, not lose the human touch, and not lose the connection to physicians. So it all came together really nicely.
I guess I have a quick follow-up question for you, Glenn, because like I've heard with the rise of telehealth and virtual care and all these companies that do all these different things, I've heard the same thing. It's like employers a little bit are looking for consolidation. Do you think there's a need for greater consolidation when it comes to telehealth?
Well, now more than ever, there's that need because, first of all, both companies were growing very quickly, very rapidly, and doing well on their own. But with the advent of the coronavirus, the pandemic, we knew that more than ever, people with chronic conditions needed us to keep them safe, keep them secure and healthy, and in many cases at home. They couldn't even go to their doctor's office or the ER if they wanted to. So telehealth became absolutely essential and will be for the foreseeable future. That's never going backwards. And so we were fortunate to say, who's the best, who's the largest, who's the most sophisticated? That was Teladoc. And then I think at the same time, Teladoc said, how can we provide more services to a big portion of our population that has chronic conditions, whether it be diabetes or hypertension or behavioral health? They were already the leader in behavioral health. So from that perspective, putting them together to make it easier for employers, large self-insured employers, but also the government, also large payers, to go to one place and say, let's just contract and get it all but also for the people to have that experience. So I think from that perspective, again, the advent of the pandemic simply accelerated what was happening already, but it accelerated it by a few years.
Mm-hmm. Now that you guys are starting to look to the future, what's next for Teladoc Health and Livongo?
Well, we're excited as we're going through the integration process, and that's a deeply collaborative process between the two teams. We were able to sign a commercial cross-selling agreement, and we're very happy to report that we're making progress on that. In fact, we have our first cross-sale to a large, prominent health plan. GuideWell Health, which is the parent company of Florida Blue, has been a Teladoc Health customer for a while now, several years, and that's been an expanding relationship. And we were very, very happy to be able to work with Glen's team to bring Livongo for diabetes to the Florida Blue membership and create that relationship with GuideWell. And Glen, I don't know if you want to talk more about what we're bringing to that membership.
Yeah, I'd love to, because it's super exciting. Teladoc was already there. They loved Teladoc. They were using it. And we were trying to get in there. And Pat Garrity, the CEO of GuideWell, he's very innovative. So we knew at some point we would. But when the organizations announced we were coming together, and when we signed this kind of co-marketing commercial agreement, it went very quickly. And the next thing you know, now they're going to be launching to 50,000 of their members at GuideWell, which is, again, Florida Blue is their subsidiary, and they have something called On Life, which is their consumer channel. And all of these people who have chronic conditions will now be able to access this as a part of that. That wouldn't have happened without the connection with Teladoc. Again, maybe it would have happened in the future, but right now it's going to happen much more quickly. And from GuideWell's standpoint, they can go to their entire base. They're already the leader in the state with Florida Blue, the biggest brand in the state for healthcare. But now they can go to their members and say, we hear you. We know how challenging the pandemic is for people with chronic conditions. And now we'll combine industry-leading Teladoc services with industry-leading chronic condition management from Livongo. So it's a big win. We're super excited about it. And it's the first example of why this merger makes so much sense.
And Blake, I would say it's really a testament to what you alluded to in your last question, right? Clients looking for a single integrated solution that brings all of the assets of the two companies together for episodic care, for chronic care, for complex care, all through one interface, through one front door, such that a physician may be talking to a Florida Blue member about something other than diabetes, but learns about their diabetes and brings to them the Livongo capabilities at no copay for the consumer, completely covered in a mechanism that is incredibly consumer friendly. And similarly, we're able to get the data from the Livongo blood glucose monitor into the hands of the physician, deliver it right to their desktop when they're interacting with the consumer, and deliver better healthcare for them. And that's going to be accessible for 50,000 people living with diabetes in the Florida Blue plan.
Congratulations on the partnership, guys. I guess since this is like the first taker we've heard of, can you tell us any specifics around like how you'll get paid by the health plan, and then also how this program will work for patients, like in literal terms?
Yeah, I can jump in for a piece of it, and that is, just to be clear, there's a lot of takers. There's a lot of interest. There's a lot of people. This happens to be the biggest, most prestigious one we've announced so far, but there's an awful lot of activity. I'll tell you, the happiest people when we did this were both of our collective sales forces, which are now kind of merging together into one, but they couldn't have been more excited. In terms of the experience, and Jason referenced this, if you're a person with diabetes, today you have copays, You have to go out and pick up your medications. Think about that for elderly people, for example. That's a challenge. In the new world, they might be talking to a Teladoc physician, and she might say to them, I notice that you have diabetes. We can enable you to get strips sent to your home at no cost, no more copays. They're delivered automatically, and I can then see your readings real time, whether it's diabetes, whether it's hypertension, whether it's weight management or diabetes prevention or behavioral health. And that makes the physicians really happy because they have better information than they've ever had before. And that is a win-win. It's really saying better experience for the person, and it's actually better for the physician because they love to have all the data right in front of them so they can make better decisions. Jason, what did I miss?
I think you covered most of it. The one thing is the longitudinal nature of the data that we can get from the Livongo devices, right? And so the opportunity, when you walk into the physician's office and they take your blood pressure, they're getting exactly one reading at exactly one point in time, right? They're not getting the reading every day for the last 2 weeks when you then interact with that physician, and the physician can see what the curve looks like over time. That just delivers more and better data such that the physician can deliver better care. They know, is this an anomaly because you have white coat syndrome and your blood pressure spikes when you go into the doctor's office? Or is this something where you really do need to have your lisinopril adjusted and, titrate those medications? And the same is true for people living with diabetes and their insulin. This is just a better way to deliver care. And by integrating these two companies with 750 million data elements in the Livongo data set and 10 million virtual visits and all of the data that comes out of those virtual visits just this year, that is a data set that's never been had before. And then we apply the Livongo data science against that to deliver a level of care that has been previously unavailable.
Now, that's a good segue into one of the things I wanted to talk about with you guys, which is AI. I've heard from some of the smartest people in this industry that AI is just not anywhere close to reaching its full potential in healthcare. And they say, that's not because we don't know how it works. It's because the difference between creating an algorithm and then infusing it into the healthcare system, into a physician's workflow, is incredibly difficult. But to me, you guys have an interesting opportunity because Livongo's AI platform will have insights on Teladoc's patients and vice versa. So in some ways, it's like the two worlds will be combined, like you said, in kind of one of the first data sets of this nature. Maybe Glenn first and then Jason, can you tell us about how Livongo's data platform works and describe the full opportunity of this technology?
Sure, I'd love to. That's a great question, Blake. We call it AI plus AI. And for a long time, the industry has known how to aggregate information. That's the first A. And then they've known how to interpret it. So here's all this data that we're gathering from all different sources. And now we're interpreting it to say, what does it mean? And that's where it stopped in most cases. What we were able to do at Livongo was add another AI. So aggregate, interpret, and then we were able to apply it. We would apply it back, deliver it right back to those people to say, based on all this data science and your own personalized data, here's what we would suggest. And then we would see if they use it. So think about the way Amazon says, based on all the books you read, we think you'll like these books. And they're pretty good about suggesting good books. Or Netflix, based on the movies you watch, here's a few other suggestions. Now imagine that in healthcare where we say we aggregate all the information from electronic health records, from connected devices, from CGMs or continuous glucose monitors, from Apple Watches, anything that we can get our hands on, including those 10 million Teladoc visits. We put all that into the database and we personalize it, and then we deliver it back and say, here's our suggestion for you. And then we see if you use it. If you use it, we do more of it. If you don't, we do less of it. So for the first time, we're closing that loop, just like Amazon does, but we're doing it for the first time in healthcare. And the beauty is it works both ways. We can send that information to those devices. It comes back. Now you're at a Teladoc visit, and your doctor she says, based on what I'm seeing on the screen, it's not just one reading, it's here's what your weight has been. I've noticed you're gaining just a little bit of weight, but each month over the past 12 months, and I notice your blood pressure is slowly rising. Let me suggest a few things. Those suggestions, those health nudges are provided by our AI engine. So it works in both directions. You don't lose. It's not just data science. It's got a heart. That heart comes from Teladoc, from all those physician visits, and vice versa when you're using devices and we're empowering you with information. So that, again, is part of the magic of this combination, putting both pieces together for the first time.
And extending that, I think Glenn has it on the nose, not surprisingly, but it extends beyond the physicians, right? Because we also have a network of therapists for mental health. We have a network of psychiatrists. We have a network of registered dietitians. And that network, including our physicians, is a global network. So the opportunity then to bring all of those resources to bear for the consumer is incredibly powerful.
Yeah, and that's one thing that usually, I'm stealing this from Jason, usually he talks about it, but one of the things from our perspective, our goal was, how do we get Livongo to as many people as possible? So it's not just Teladoc's presence as the leader in the United States, but it's more than 50 countries around the world. The expansion opportunities for us would have taken us years. And now, all of a sudden, because of their network, this truly is the power of digital is we can provide it anywhere in the world, 24 hours a day. And so now you've got not only, the first virtual consumer-centric virtual care company, but the first global consumer-centric virtual care company. So pretty exciting stuff.
Can you talk a little bit about the nature of the health nudges? Like, I think we understand them in the context of diabetes, but if you're building them out for other conditions like mental health and behavioral health, and the list goes on, what might those look like? And at what point would a patient maybe get kind of escalated to a Teladoc physician?
Jason, you want to start? I'm happy to start, or you can start.
Why don't you start on the nature of the health nudges, and sure. I'll take the handoff to a Teladoc physician or therapist.
Sure. That's kind of a question where you can see us both learning about these processes. So at Livongo, we have a MyStrength product, for example, and mental health and behavioral health so important today, especially with all the challenges that people are dealing with. So this is a digital front door, and it allows people to start to say, hey, I have some questions. I'm feeling maybe a little depressed, or I have this other issue, and I go to a digital app. And then at a certain point, they say, maybe that's not enough. And that's where the step therapy comes in. And that's where, again, we can start to take advantage of the Teladoc network of therapists and psychologists and psychiatrists and anything else you need along that spectrum. Jason, maybe riff in.
Yeah, and the therapist can work with a psychiatrist, so it's a team approach to therapy, so that the psychiatrist may be, modulating medications, trying different medications, but working with a therapist in tandem for more longitudinal cognitive behavioral therapy, dialectical behavioral therapy, mindfulness exercises. And that's where they can use the assets of MyStrength to bring in digital tools to supplement what they're doing, right? So you may have an interaction with a therapist once a week, and between that, your homework may be to work on a digital CBT program, which can be incredibly powerful. And then all of that, we employ measurement tools to see how the consumer's doing. How are you doing over time? And that's, again, where those health nudges can come in, because if we learn that the consumer's doing a little better, they're feeling a little better, they're feeling more empowered, they're more motivated, that's great. We keep moving them along the path. If they're sliding backwards, then we have a new intervention, and that's where we trigger a therapist to reach back out to the consumer, because we know that that's necessary and helpful at the time.
And it also empowers people. We're putting, think about telehealth to begin with. You now, in the middle of the night, whenever you need it, you decide, I need to talk to somebody, and within minutes, you're talking to a physician, you're talking to a therapist. We put people back in charge. That's so critical in all of this. The other thing I'd say is, look, if you have multiple chronic conditions, you're more likely to need to talk to somebody once in a while. It's tough to deal with all these chronic conditions. So having that full range, that full step therapy, but it also doesn't overcharge people for care. Look, we have a cost problem in healthcare, and using the right amount of digital paired with the right amount of step therapy also makes our large employers, our government contractors, our payers very happy, and it should make all of us happy, because at the end of the day, we're footing the bill. We can point to other folks, but it ends up coming back to all of us. So we want exactly the right amount of care at the right time, and that's what this is all about. That's why we did it.
And Blake, I think all of these capabilities come together to paint the picture for how we get to virtual primary care and really reimagining what primary care should be, right? Rather than being a checkup once a year and 1 or 2 visits for, sore throat or the flu, and that's really it, and no interactions in between that. This becomes a longitudinal relationship that brings multiple professionals and all the digital assets and the data science all to bear for the consumer, interacting with multiple devices, whether it's your Apple Health Kit or your Fitbit or any other device that you use to track your sleep, your steps, and the opportunity to bring all of that to bear in a single place that's delivered to the consumer on their terms where they are has never been done before. And that's the opportunity to truly reimagine how primary care should be delivered.
And Blake, let me give you one example. My youngest son, Sam, was diagnosed with type 1 diabetes many years ago. And so we've been dealing with this, and now he deals with it as a young adult. But years ago, we used to have to wait and once a quarter go and see the physician. And now, because we have connected devices, a physician could manage 2,500 people, and she or he could look at this and say, here's the 3 people I want to talk with because they're not using their medications right. So this idea of virtual primary care, what Jason's talking about reimagining, it's a way to prevent illness. It's a way to catch things before any of us might even know what's happening. Again, this idea of every month, something, your blood pressure is inching up just a little bit. You may not notice it, but our data science will pick it up, and we may actually initiate calls in the future to say, hey, we're seeing a trend here that's not good. So we'll prevent the bad stuff that happens in healthcare. And that's always been the dream. And now we can make that come true. So again, I think you can see our excitement about what we've done together. But I think most important, our clients are excited.
Well, thank you, Jason. Thank you, Glenn. Unfortunately, we're out of time, or I would keep pelting you with questions.
Wait, we want to tell you more about all the things we're doing. Jason and I could talk about this for hours. Thank you. Thanks so much.
I'm available offline. Thank you both. Thanks for your time.
Thanks.
Thanks, Blake.